We have here a plate specimen. This is cross-section of the thigh, right above the mid segment. So we have mentioned that the thigh is divided into compartments, but before that, let me identify some structures first. The outermost boundary right there, that's the skin. Then you can see the subcutaneous connective tissue, which is infiltrated by fat. And then this well-defined connective tissue outline, that's the fascia lata. You can see it forms an enclosure that will completely surround the whole circumference of the thigh. And extending from the fascia lata, going deep to reach the linea aspera of the femur right here. This is cross-section of the femur. You can see the cortical bone of the femoral shaft, and then you have the marrow cavity right there. That connective tissue structure, that's the septa, fascial septa, that will create the compartments. We have one right there, another one right here, and another one right here. So the fascial septa will separate the anterior compartment from the middle compartment and from the posterior compartment. Now, your book has discussed something about compartment syndrome. The restrictive nature of the fascia lata and the connective tissue septa, actually it can it contributes something good here in the thigh. If you have infection, example, you have a soft tissue infection, cellulitis involving the cellulitis and myositis involving the anterior compartment. The restrictive and tough nature of the connective tissue septa will limit the spread of infection. It will contain the infection in one compartment only. But that is not the case when the offending microorganism is connective tissue digesting, connective tissue digesting enzyme. Those microbes that we call flesh-eating bacteria. For flesh eaters, they can spread. They can spread uncontrolled, because they can degrade or digest the connective tissue, the collagen material in the connective tissue of the connective tissue septa or the fascial septa. So if you have bleeding also within the compartment, if there is bleeding in one compartment because of injury, example, we have femoral fracture resulting to injury to the blood vessels here. By the way, the blood vessels here will be the deep artery of the thigh or profunda femoris artery, and you can see the venae comitantes right there. If the artery is damaged, then you have bleeding here. There will be pressure build up because of the constricting nature of the fascia and the connective tissue septa, and the pressure can actually aggravate the injury and cause the necrosis of those structures that are compressed within the fascial compartment with bleeding. So in case of compartment syndrome, fasciotomy is performed. What is fasciotomy? Incision is made in the fascia lata to release the pressure, no, and to relax its constrictive nature. So let's identify, let us identify the muscles, no, and other structures here, blood vessels and nerves. Starting with the anterior compartment structure, we have the rectus femoris right there, sartorius. We have the vastus lateralis, vastus intermedius, and the vastus medialis right here. No? Vastus intermedius is deep, no, to the rectus femoris, and vastus lateralis medialis. So that's the femoral artery and its venae comitantes. And then we have the nerve fibers, no, you can see them very small cross section. They are branches of the femoral nerve. So we go now to the medial compartment, no, adductor compartment muscles. At this level, adductor brevis is not seen, including the pectineus. What we have here is adductor longus. We also have the adductor magnus, no, and gracilis. We have identified profunda femoris and its venae comitantes right there. Then we have cross section of nerve fibers. So posterior compartment, no? As mentioned earlier, no, this is level, no, above the mid part, no, of the thigh, because you can see the this one is biceps femoris muscle, no, and this right here is the tendinosus, no, semitendinosus, and little part of the semimembranosus is seen. If you have cross section at a lower level, no, the biceps femoris will be located farther from the semitendinosus, and the belly, no, of the semimembranosus will be bigger, and then we have this structure right here. What is this? No? This part, no? That's the cross section of the sciatic nerve. Now you can even see the fascicles, no, of the nerve. So this part of the femur, that's the linea aspera again. No? That's a sharp ridge at the proximal part of the femur.